age-related macular degeneration is exactly as the name describes it. It's an age-related process that occurs usually in the patients over the age of 60, and it's literally a breakdown of one of the layers of the back of the eye called the retina. It's usually seen in patients that are Caucasian, but it can occasionally have diagnosed in patients who are African American and Hispanic. The main test is going to be a dilated eye exam. So once the patient comes in through the door, there are a slew of imaging modalities I have that can help me pinpoint exactly the location of the damage that's occurring, and that's how I diagnose them with the age-related condition. The dry kind is essentially a breakdown, just like we've described, of the retinal barrier, but it's a slower process. Prevalence of that is about 10 million people, 10 to 20 million people in the nation that have it. The wet kind's a more of an aggressive form. It's essentially bleeding that can potentially occur along with fluid formation. Both of those can ultimately lead to scar tissue, which then ultimately affect the center vision. Moving over to the wet kind, which is a more aggressive form. The wet kind, we can reverse some damage, and the main reason is patients who have blood in there, if the blood gets resorbed from these injectables that we have, their vision quality should improve.